So for couples who are trying to conceive naturally, the most important thing that you can do is have sex. And ideally have sex at least every other day. Every day is best, every other day is pretty much just as good. And ideally, around the time in a woman's cycle when she is fertile, which is typically midway between her periods. So if a woman has monthly cycles, typically ovulation or egg release will occur somewhere between cycle day 10 and 20. So frequent intercourse is best, but frequent intercourse during that time is critical. There's no magic position. You don't have to stand on your head afterward. There's so many myths out there. For the vast majority of people, you just need to have sex. So all women who are planning a pregnancy ideally should take a general multivitamin that has at least 400 micrograms of folic acid. Any multivitamin for women, any prenatal vitamin will have that much folic acid. In addition, there are vitamins that have been suggested to be particularly beneficial for people who are struggling with fertility difficulties. For men, these vitamins might include folic acid, zinc, coenzyme Q10, and other antioxidants like vitamin C and vitamin E. For women, many of the same vitamins. In addition, coenzyme Q10 and DHEA, specifically for women who are older, over 37, and trying to conceive. There seems to be some specific benefit for egg health and egg quality with those vitamins. How caffeine can affect fertility is not necessarily in fertility specifically, but we know that women who have an intake of caffeine more than 250 milligrams per day are at higher risk of early pregnancy complications such as early pregnancy loss. So we encourage caffeine in moderation when trying to conceive, and that would typically be less than 150 milligrams a day, which is the equivalent of 1 strong cup of coffee or 2 sodas. For men, there doesn't seem to be a major impact on caffeine intake and fertility, although there hasn't been great research at this point. Alcohol, also in moderation when trying to conceive, does not seem to have a major impact on fertility. Obviously, alcohol once pregnant for a woman would be potentially problematic for the pregnancy. So once pregnancy is achieved, we would recommend abstinence, no alcohol. But while trying to conceive, alcohol in moderation, which for women would be no more than a few drinks per week, no more than 1 to 2 drinks in a sitting, and for men, no more than 7 to 10 drinks per week, and no more than 1 to 2 drinks in a sitting, does not seem to have, that amount of alcohol does not seem to have a negative impact on fertility. Tobacco is a very different story. Tobacco, especially smoked tobacco like cigarettes, are really bad for eggs and sperm. So just don't do it. So the most important lifestyle factors that affect fertility are maintaining a healthy weight, eating a healthy diet, and exercising regularly. And of course the question is, well, what does that mean? What's healthy? So for most adults, maintaining a weight or body mass index under 25 is considered healthy, but we don't really see major effects on fertility until the body mass index gets above 30. A healthy diet for fertility is a diet that is colorful, that is rich in fruits and vegetables, lean proteins, healthy fats like avocados and nuts. A little bit of fish oil or fish contributes great omega-3s, which are necessary for fetal development, and dairy fats also are an important source of fat for baby making. A diet that is low in processed foods and low in sugar will help maintain a healthy weight, as well as be the ideal diet for fertility. And moderate exercise with regular frequency, ideally at least 30 to 50 minutes, 3 to 5 times a week, would be the healthiest exercise regimen for a couple trying to conceive. And that goes for both men and women who are planning a pregnancy.